Seeing lots of familiar names and lots of new names. This is very exciting. Welcome everyone to the webinar. We're going to wait just a minute or so to make sure we get everybody admitted into our webinar, and then we'll be getting started shortly. While we're doing that, we'd love for you to drop in the chat. We always like to find out who's joining us. So let us know if you've been integrating palliative care into your graduate programs. And maybe what that looks like while we wait to get started. Hey, Susan. Sorry, what do y'all think? All right. Well, again, welcome everyone to our fall webinar series. I'm Megan Lippy. I'm one of the co-investigators with LNEC, Supporting Schools of Nursing, and my colleague in this is Dr. Davis, who will be closing us out. So I'm going to get us started this morning, and we have two amazing experts in graduate palliative care education who are joining us today, who are going to share what they've been doing and hopefully ignite some thoughts for y'all into how you might do this in your programs. But our speakers today, first we have Dr. Carrie Cormack, who is an associate professor at the College of Nursing at the Medical University of South Carolina. She is the lead palliative care faculty in the Doctor of Nursing Practice program. She serves as faculty with us with LNEC and the Hospice and Palliative Nurses Association. Dr. Cormack teaches palliative care to interprofessional healthcare clinicians and students locally, regionally, nationally, and internationally. She is dedicated to increasing palliative care education in nursing programs around the globe. In addition to her faculty work, Dr. Cormack practices as a pediatric nurse practitioner in perinatal palliative care at MUSC. And our other presenter today is Dr. Kathleen Lindell, who's an associate professor in the Mary Swain Endowed Chair in Palliative Care Health at the Medical University of South Carolina College of Nursing, with a joint appointment in the College of Medicine. She is a graduate of the St. Francis General Hospital Professional School of Nursing, where she got a diploma RN, and the University of Pittsburgh School of Nursing, where she earned her BSN, MSN, and pulmonary specialty and PhD. Her role as the Mary Swain Endowed Chair in Palliative Care Health is to advance and promote awareness of palliative care among healthcare professionals, students, patients and their caregivers, and the public, ultimately to improve quality of life for patients and families affected with serious illness. And we welcome them, and we're going to turn the floor over to our incredible speakers.
Wonderful. Can you guys hear me and see the screen okay? All right.
Yes.
Well, thank you. It is so nice to be here. I'm going to get us started today. I am Carrie Cormack, and thank you, Megan, for that great introduction. Our title of our talk today is Advancing Compassionate Care, Our Journey Through Graduate Palliative Care Nursing Education. And as those of you know that are here today, likely all in education, it's always a journey. So it's been quite a journey, and a wonderful journey, but kind of a bit of a long one. I like to start by just saying that when we started this was a little bit accidental with talking to some of our graduates, so our graduate nurse practitioners new in the field. And when I started just being interested in palliative care and palliative care education, I asked them quite candidly, how do you feel about getting ready to go and take care of patients out in the field? And how do you feel about taking care of dying patients? And that response was kind of what ignited in me a real passion to make some changes, because the responses I got from that question were not much confidence, and really a scary response that, please do not assign me a dying patient. And I realized that we were doing very little in our palliative care education with our students at the graduate level, really in all of the levels across our college, but where in undergraduate, we had a whole semester for birth and the beginning of life. We just had a couple lectures on end of life and what that meant for nurses. And as I grew in my palliative care journey, I realized that really this foundation needs to start by our students during their nursing journey. So I'm really proud of the work that we've done, and I'm excited to be here with my colleague and friend, Dr. Lindell, to talk to you more about what this journey has looked like and hopefully have some time for discussion where we can learn from you and what things have worked in your institutions, what barriers you might be facing, and how we can kind of learn together to just make this better for our students. So our next slide was about us, but Megan did such a great job. I'm going to skip over that and get right to our objectives. So we're hoping that by the end of this presentation, you'll have a better understanding about the development and implementation of palliative care across your curriculum. And you can identify maybe some strategies for integrating palliative care principles, specifically into graduate level nursing curricula. We'll talk a little bit about the national competencies and standards, and then explore some innovative teaching methodologies that have worked for us, that have really helped our students gain a deeper understanding of palliative care concepts. Probably, if you are here, I don't need to go into too much detail about this slide and what these important guidelines mean for what we're doing in the field of nursing education. We all know about the Institute of Medicine's Dying in America, as well as the ANA and HPNA's call for action in 2017, and how these really called on nursing faculty to do better, better education for our students and our nurses at the bedside. The NCP guidelines that were published, the newer ones in 2018, are really the blueprint for what we are doing for our patients and families and can help guide us as faculty as we teach our students. And then, of course, the essentials. And that certainly has spearheaded a lot of the work that's being done, including these webinars that we're being part of right now, because those essentials are telling us that not only is providing palliative care education to our students the right thing to do, but it has to happen in order for us to be compliant with these essentials and recommendations. And then in the middle of all this, we had the COVID pandemic, which truly highlighted the fact that nurses were being called upon to care for patients at the bedside, often the only ones there. And we realized right then and there the importance of making sure they knew how to advocate, care for, and promote quality of life for patients who often were dying alone. So all of these things together, I think, justify why we're talking about this, even above and beyond. It's the right thing to do. And for those of us that are passionate about palliative care, we know that it is the right thing to do. So we're going to start first with now I'm going in the wrong direction, with a story about a couple of our students, Beth and Jessica. So meet Beth. Beth graduated from nursing school in 1996. Some of you may recognize her uniform. And she graduated and worked as a hospice nurse. She really developed her competence in her clinical work. She returned to get her master's in 2003. And as an AGNP, she worked at the bedside. She decided after a few years of doing that, she would return to school to complete her DNP. After working in hospice care and then as an adult gero nurse practitioner, she really wanted to find a school where she could focus and follow her passion in palliative care. Jessica was a graduate of our undergraduate program at MUSC. She completed her undergraduate ELNIC training through the Relias ELNIC curriculum as a student. Jessica graduated and started working in the medical ICU. And I quote her in saying, "My passion for palliative care began while I was working in a medical intensive care unit. Being an ICU nurse, I would often see patients at the end of life and the turmoil it caused them and their loved ones." So Jessica also decided to return. She decided to return to get her PhD with a goal of researching unmet needs of women with COPD. Both Jessica and Beth chose MUSC due to our commitment to palliative care and that our graduate programs aligned with their passion, their interest, and their lifestyle. Our DNP and PhD programs at MUSC, they're both online. they're asynchronous, and they're hopefully conducive to adult learners. So we'll talk a little bit more about Beth and Jessica as we progress. And I'm going to turn it over now to Kathy to talk a little bit more about our palliative care program and how we have kind of grown over the last couple of years.
So thank you, Carrie. So our program in palliative care really was started by Carrie and her vision back in 2017. And if you work with Carrie in any capacity, you feel that her passion is just so palpable. So it was easy for leadership to buy in and support what she wanted to do. And plus, it's the right thing to do. So we are fortunate because we also have a model of excellence clinical team. And you may know many of these people. So Pat Coyne has been here for probably 10 to 15 years. And so he really grew our clinical program from a group of 2 to now there's probably at least 35 people across adult, pediatric, in the inpatient and outpatient arenas, and then in addition across the state of South Carolina. So we have a really big focus on working collaboratively with our partners across all the health professions. We have an endowed chair of palliative care, which is the role that I hold. We have a distinguished professorship in palliative care, which is a role that Carrie holds. We host an annual palliative care showcase, and the intent of that is to really show the work that is being done at our institution and across South Carolina and across the nation. And then most recently, we're really excited because we have hired a palliative care education coordinator. So our next slide. So I'm not sure if you've seen this slide before, but this has been presented at a few conferences, the American Academy of Nursing, I think, and then within the College of Nursing at our showcase. And the title is Transforming Palliative Care Nursing Education. So this walks you through, the purpose, the strength of the evidence, the implementation strategies, and the practice that the changes that have occurred with our nurses and our students. And really the takeaway is that our College of Nursing is contributing to the primary palliative care workforce in bedside nursing by providing this palliative care education to nurses caring for patients with serious illness and at the end of life. And I want to emphasize that every student that goes through our College of Nursing in the undergraduate program and the graduate programs receives LNEC, appropriate LNEC education so that when they graduate, they are competent in palliative care. And I'll turn it back to Carrie to describe more.
And we're going to talk about this a little bit more specific to our graduate students, but as Kathy mentioned, since 2017, starting with our ABSN students, we have integrated as part of their curriculum, the LNIC undergraduate curriculum. And then starting in 2020, I believe, we started mandating the graduate student with a graduate curriculum. So this slide, the numbers are a bit outdated, but you can see that across all of our programs, we do have students that have completed LNIC training. And that is something that we encourage them to add to their CV and portfolio at the end of their program as a way to demonstrate to their future providers, future employers that they have had this foundational training in palliative care. We also offer it as an elective to our PhD students that fall under the graduate programs. And something that makes us a bit different than other schools, we have also offered this and mandate it for our full-time faculty. And that's something that I think makes us stand out a bit. And part of that leadership buy-in is supporting all of our full-time faculty to complete this training in palliative care. When we started offering this and integrating it and rolling it out through the programs, I felt that it was, if we were going to make our students do it, I really wanted the faculty to also have this training and this knowledge baseline. While there was certainly some resistance to doing so, I think we have received a lot of positive feedback. And it's just a way of demonstrating further our commitment to this initiative, and certainly demonstrates that the College of Nursing really believes in palliative care and has really prioritized this across the board. And I won't go into this, but I think this slide nicely demonstrates kind of the widespread approach that palliative care has had across our college. You can see here in our dean, Dr. Kathy Durham, she sits at the top, of course, but we really have kind of tentacles of palliative care spread throughout all of our programs here. And that includes education, clinical practice, and research. The end result is always keeping in mind the patients and the families and their caregivers that we serve. And truly all of our work lines up and hopefully ends with an improved quality of life for the patients and families in our community and beyond. But if you can see here, we have lots of pieces going on throughout our education, throughout the clinical practice, and throughout the research. And all of this falls in our College of Nursing. So certainly very fortunate to do this work, to have this incredible support, but it has been a journey. And without a lot of people and just forward movement and stakeholders and meetings and lunches and fundraisers and begging and some prayers, we have kind of built this village. And now we're finally seeing the results of students that are seeking us out because of the priorities that we've made in palliative care and building some new programs down the pipeline. So it's really exciting. So when we think about our graduate programs, we have our DNP program, certainly, and then we have our PhD program, and then we have things that are offered to all of our graduate students. So I want to kind of go through this a bit in a little bit more detail, but let's see, the graduate student experience. So all of you hopefully are familiar with the Relias graduate curriculum, and that is the online LNIC modules that are designed specifically for graduate students. Our students all receive this curriculum, and it's weaved into what we call our roll course. This is the course that our master's students take right before graduation, and our DNP students take in the summer before their residency. So it's towards the end of the program. The students have had a bulk of their clinical hours done, and they are assigned the Relias graduate LNIC curriculum. We treat it as an assignment in this course, and they have the entire semester. It's a summer semester, so a bit shorter, but the entire semester to complete. In addition to the curriculum, we also have some PBL contents, where we work through different cases that palliative care and end of life is weaved into different patient scenarios. We offer clinical hours, whether it's here with our MUSC team or in the different cities or towns that our students live, because we are an online program. So we have students from around the country, and we allow them to have certain number of clinical hours in palliative and or hospice care, kind of depending on their track, but all students have that as an option. We do have specialty expert lectures weaved into their learning intensives, and that includes advanced communication training. So we provide all students, when they come to campus during one of their learning intensives, an in-person advanced communication training. That originally was based on Vital Talks. Some of you may be familiar with Vital Talk. It's kind of expanded from there, where we weave in a lot of the LNIC communication content, as well as some role-playing activities. But that has proved to be a very engaging and a wonderful time to have with students to really work through sharing difficult news and difficult discussions. oops, sorry, I didn't advance my slide in time, but that's kind of what I was talking through. We do have also, in addition to those all graduate student experiences, we have some elective graduate student opportunities. That includes a palliative care advanced practice provider externship. This this is something that's been going on for several years originally through a grant through Cambia. Only in the last year, MUSC has kind of taken this on and offered it as one of our elective student opportunities. It is for all advanced practice providers throughout the country, but also we allow students to engage in this. And it's 3 days of didactic curriculum offered virtually. But it is synchronous. So it's 3 days where they meet together as a group, and then 2 days of clinical time with our MUSC Model of Excellence clinical team here in Charleston. The palliative care APP externship is offered 3 to 4 times a year. It's run by palliative care experts Connie Dolan and Patrick Coyne. We're actually hosting a cohort right now. So as we speak, we're doing our October cohort. We have another one in February and then April of next year. So we'll give you some information at the end, but if you're interested or want to pass along to any of your students, it's a great way for students or for APPs in the community to gain some additional knowledge and skills in palliative care. It complements the ELNIC curricula, but also dives a little bit more into program building and actual the role of the APP. As I mentioned, we have clinical opportunities for our graduate students. We have 2 palliative care elective courses that any student within our graduate program can sign up for and take, Palliative Care Management 1 and Palliative Care Management 2. And then we always offer mentoring and certainly support for any DNP or PhD student that wishes to do their projects in palliative care. And over the course of the last several years, we've really seen an increase in this. And certainly it's always exciting to talk to graduate students that are interested in really diving into a project in palliative care, because those of you in graduate programs know that that is really just the meat of their program. And I always tell students, if you're going to spend a lot of time and energy and reading and writing on a subject, to be passionate about it and it to be in an area that you choose and feel really strongly about can really make a big difference in the success of your project as well. So I've been just honored to be part of some really great palliative care projects over the last few years.
Carrie, can I pause just for a question?
Yes.
It's like maybe this would be a good time to answer or address Gina's question about what tracks you have in the DMP program.
Oh, yeah, sure. Sorry if I didn't see that coming across in the chat.
Oh, that's okay. I'll do that for you.
Okay, perfect. So in our DMP program, we have FNP, pediatrics, psych mental health, AGMP, and then we have our, and I'm going to talk about it on our next slide, but our postmasters to DMP in palliative care track. Given the kind of the growth of our palliative care programs, we have offered students that truly want to be involved in palliative care from the beginning to get that palliative care focus in addition to the other tracks. So I can mention that again, but yes, hopefully I mentioned them all: family, pediatric, adult, and psychiatry or psychiatric mental health. Here are a couple of quotes that we have, student feedback, always just really positive. And the number one thing I hear all the time is that these elective courses that we offer, they wish they were required for all students in all programs. So, you know, as good as all this is and as wonderful as it all is, I always am just fighting for more. And I wish that all of our students could be taking, you know, courses in palliative care, and we're not quite there yet, but the students that do take these courses really get a lot out of it. What I love about these courses especially is what the student says. We talk a lot about their personal feelings about death and dying and serious illness. And a lot of reflection is built into these courses, which I think isn't always done in doctoral level graduate work. And I just really believe in reflection as a modality of nursing education, and feel so fortunate in a palliative care course to be able to do that. And I think the students really appreciate it as well. So my next slide is about our postmasters to DNP in palliative care. And we were the first to do this, kind of have a focus of a DNP in palliative care when it opened in 2020. I think since then, there's been a couple other programs that have followed suit. And while it's still going well and students are really interested in, and we've received some great support, what I have learned through this is that it's really students across all programs that have this interest, not just the postmasters. So, which is why we've kind of opened up our courses to other students, opened up the possibility of doing a project in palliative care, and really kind of expanded our reach. So it's not only the postmaster students in this program that have the ability to kind of do all the things in palliative care. But this postmasters to DNP, you're able to
Another
complete in
slide,
5.
Carrie,
Yep, go ahead.
sorry, did you mean to have another slide?
Yep. Thank you.
Okay,
I don't know
sure.
why I'm looking at 2 different things and this one's not showing. There you go. Thank you. So the focus, it's exclusively online, able to complete in 5 semesters. The focus is on care for individuals with serious illness. We include those 2 specialty palliative care courses, a project in palliative care, residency or clinical hours with palliative care clinical experts, and then students that complete can also be eligible to sit for the Hospice Credentialing Center certification in palliative care. So back to Beth and Jessica, and I'll turn this back over to Kathy.
So how about, do you want to talk about Beth first? Because you know her better than I. And then
Okay, sure.
to Jessica.
So jumping forward, Beth came to our DNP program and she successfully graduated from our postmasters to DNP and palliative care program in 2023. Graduating with her DNP, she's now a team leader on her palliative care team at her hospital and had a nice promotion with her doctorate. So fast forward to just last month, I was so proud of her because she presented her results of her DNP project during a 60-minute podium oral session for the 2024 team conference for the Hospice and Palliative Care Nurses Association at the Maryland School of Nursing in Baltimore, Maryland. This was a title of her talk, and she also successfully published her manuscript in the Journal for Hospice and Palliative Care Nursing. So really, really proud of her. And in just talking with Beth about her making the choice to come back to get her DNP, to focus in palliative care and to be part of MUSC and the growing initiatives in palliative care, she just couldn't say enough positive things about her experience as a student, as well as just what her future means to her. Her dream for several years working as an NP was to really just be proud of the work that she's done and getting published, and then having her abstract accepted at a national conference was a dream come true for her. So just really proud of her hard work, and I always love to see our students shine, especially after they graduate and flee the nest.
So this is the update on Jessica. So as Carrie mentioned earlier, Jessica was a MICU nurse, and she detected in her practice that women in particular with COPD in the intensive care unit weren't receiving the same care as the men were. And so she came to our program to obtain her PhD in nursing science. And this picture of her is with her dissertation chair, Dr. Sarah Miller. And what Jessica did was she did a study of 30 women with COPD. And I remember her saying to me, I want to hear about their palliative care experience. And I said, Jessica, I don't want to sound negative, but I'm going to be interested to hear if they have any palliative care exposure experience in. And so fast forward, she graduated, and what happened is that she found that these women there were 30 women with COPD. Not a one of them had ever been referred for palliative care despite a high symptom burden. And 40% didn't even get to see a pulmonologist. Their diagnosis of COPD was rendered by their primary care doctor. And so this led her to do this study and with these interviews with these patients. And she's had 2 publications here, and as focused at the bottom of the page. But we were really excited because she submitted a late-breaking abstract to the American Thoracic Society meeting 2 years ago, and it was accepted, and she won a travel award. And now she's back at she's always been at her faculty at the University of Delaware in their School of Nursing in Newark, Delaware. And she is now engaging in LNEC and trying to grow their palliative care program at the University of Delaware in their School of Nursing. So the next slide shows some of our students who, as Carrie mentioned, it's an asynchronous program. They come 2 times during their program to have in-person learning intensives. And these 3 met for the first time at the HPNA program this past spring. And Nicole was on the right, and she was the very first graduate. And then Polly's in the center, and she just graduated. And then Amy is on the left, and Amy's one of our current faculty, and she graduated as an AGMP. But in addition, she focused her project in palliative care, and she's now going to start practice in our palliative care program 1 day a week, in addition to her work as a faculty member. So we're really thrilled because she's very passionate. All 3 of these women are just exceptionally passionate about spreading the word about palliative care. And so I'd like to talk a little bit about our PhD in nursing science. We have 4 faculty members currently, and we hope to grow this, who have palliative care interest. So my interest, I'm a pulmonary clinical nurse specialist by background and have worked for over 30 years with patients with different advanced lung diseases, including pulmonary fibrosis and COPD. And I developed a nurse-led intervention for palliative care for patients with pulmonary fibrosis and their caregivers. And we're now, we've adapted it to a digital platform and hoping to be able to reach more patients with this disease. Dr. Sarah Miller is a respiratory physiologist by background. She became that before she became a nurse. And her area of focus is advanced lung disease, especially in the rural space, and COPD is really like one of her true interests. And then in addition, the use of telehealth to be able to get to patients in these rural spaces. Dr. Teresa Kelachai is a geriatric nurse specialist, and her area of interest is wound care and mindfulness and breathing. And she's adapted this over her career. And she's now really focused on loneliness in, of course, my phone is ringing during this, shutting that off. She's focused her work in loneliness, and also has an interest in caregivers. And then the newest person on our team is Dr. Diana Lane, and her area of focus is Alzheimer's disease and related dementias. And she's adapted the nurse-led intervention that I created for caregivers of patients with dementia, and has had some recent publications on care coordination for caregivers of patients with dementia. So we're very excited to grow our, what we do here. And one of our most exciting things is next steps. We've applied to the State Department in the United States for an international palliative care. And we received wording yesterday that it's pending approval and we can start to advertise for it. And this would involve starting admission in fall of 2025. And we'll have 3 focus areas. One would be palliative care, another would be symptom science, and then the third is it's going to be either behavioral health or technology or some combination. So we're very interested. For that particular program, our PhD program is asynchronous also, and so we appeal to the adult learner, and people can continue to have their their day jobs. Most need their day job to be able to support their efforts to go back to school. And we have 4 in-person learning intensives where the student comes to the college for 3 days to learn and work with their team. And then we have this increasing interest and in global health projects. And so we're very excited. As you can see in this picture, this is Carrie in doing her international work with the LNAC global team. And she is traveling all over the world, and we're very excited about that. And so in summary, we're doing, continuing to assess our needs. We have our leadership and faculty buy-in. We're exploring funding opportunities, the $1 million question: where do we get the money to be able to pay for these things? We collaborate with our specialists across campus. We utilize existing tools, including the Relias curriculum and the LNEC faculty corner. We're open to feedback, and we want to keep growing. And really, at the end of the day, we really just want to make sure that our students are able to take care of patients with serious illness and their caregivers in the best possible manner. So we'd like to show a 3-minute video that was done earlier this year.
Well, my role in compassion here at MUSC is I plant the flowers. And so my goal is to try to bring beauty to people who may be having their worst day, but also a lot that are having their best day, to just create grounds that are welcoming and give you a sense of home and less sterile environment.
I think compassion is love. It's loving yourself. It's loving others. And part of that love is treating people with a sense of respect, a sense of humility, and also treating yourself that way. I think we often get caught up in compassion for others, but not always realize that we need to extend that same compassion to ourselves a lot, most of the time.
Passion to me means to be empathetic to each other's journeys and respect that journey and try to be helpful as much as you can with that.
I think compassion is having empathy with others and understanding that people are coming from a variety of backgrounds and different daily situations, and really, when you're responding to people or when you see someone on the street, just having an understanding that maybe the snapshot that you're getting is not the whole picture, and giving people the benefit of the doubt.
To me, compassion means caring for my patients as if they're my own family and doing the best that I can to step into their shoes to understand their situation.
Compassion means caring with everything from the heart to take care of anyone and everyone, truly doing everything you can to love and really just take care of your patient with everything that you have in you. Compassion means having empathy for others and being selfless and just helping people, like having a lot of empathy for other people and kind of putting yourself in their shoes.
Well, I think as human beings, I think we need to be more compassionate. There's a lot of times we see things and just walk past them. Homeless people, people broke down the side of the road. And I think that we should be more compassionate, not just for those people, but others that are in need, like giving blood, doing things like that here. Working here at MUSC, that's what I think a lot of us are, is compassionate.
So what we did when we did this, we literally walked out the front door of our College of Nursing, Dr. Cormack, myself, and our videographer, and we went to people on the street. We were doing this, another presentation, so we thought, well, who else better to provide information are those people that work on our campus. So we were really excited with that video. So for more information on palliative care at MUSC, you can scan this code. And then we have some resources and references that are in the next two slides that we're more than happy to share with you. And I guess the next thing is we open it up for questions. And thank you for your patience and your questions.
Wow, that was great. I love that video. Just so you know, everyone will get the slides. It'll come as a PDF in an email to all of you that signed up. So you'll get those references there. I'll start it off with a question. I have a question. I wrote down a lot of questions. I'm kind of curious about how you, on the one slide where you had the kind of model at the College of Nursing and all the different ways that you are impacting palliative care, education was also including of the community. I think I saw that on the slide. Can you talk just a little bit about what you're doing to outward facing within your community?
Sure. And I think, that's probably the one link that we're like wanting to put the most effort in now that we've secured. I think Kathy mentioned Tiffany, our palliative care education coordinator. But as we're growing this palliative care education model, like I think our outreach to our community, to our patients, and to our families needs to be addressed. Like we can't just be a great place for professionals or students to come for palliative care education, but we need to be inclusive of our community. And so an easy start to that is LNIC courses, hosting LNIC courses here in our building for community members and just offering education that way. So it's outside of our curriculum. It's for non-degree seeking any learners that are out there that want to learn more about palliative care. We serve community nurses, and MUSC is now spread throughout the state. So when there are units or leaders within the hospital setting or in community clinics, and they're caring for patients with serious illness, they know now to come to the College of Nursing asking, what can you do to offer us palliative care education? And we've done unit trainings on palliative care. As I mentioned, we've done LNIC trainings. We are building a repository that will be incorporated into our website. So if caregivers, patients, other health professionals want to come to learn more about what is palliative care, where can I learn more about getting palliative care for my loved ones?
Chicago only voters in this line, please.
Having that to allow other people to access. So those are a couple things. Kathy, can you think of others?
Yes. Yeah, we have developed a close relationship with our Center for Healthy Aging here at MUSC. And it was just by chance. But what I noticed when I started going to the meetings is there was no nursing representation. And so we now have two, myself and another one of our faculty are the education and outreach leads for the Center for Healthy Aging. And one of the events is they do a MUSC Senior Expo every year. And this past March, they held it in the local convention center, and there were over 600 attendees, and there were 120 vendors and throughout. And one of the vendors was our MUSC palliative care program. And so we were able to have like an outward facing event where we could share the information about what palliative care was correctly.
And I think that brings up, something we didn't focus a whole lot on in our overview was just this relationship that we've built with our clinical team. And, we're certainly fortunate to be at an academic medical center, so we have close access to a team. But I think for anybody out in, teaching, if you can partner with clinical teams, because truly we can't do our didactic work without our clinical partners and kind of vice versa. So we found just several years ago that building these programs together, sitting at the same table and collaborating about what type of education is going to be most helpful for our learners, doing that with our clinical partners has really taken us to this next level. Where we've been able to reach the community, where we've been able to reach outlying hospitals and community partners and private hospices and other things that, truly we probably wouldn't have had as much access to if we were standalone. So by being together, we're definitely stronger. So that's something that's helped as well.
Absolutely. And thanks for pointing that out. It does make a difference if you're at a, healthcare based kind of institution where you have those partners, and a little bit more challenging if you don't. I wanted to also, Christy had asked a question. You had mentioned you have a pediatric program, but that program is not palliative care specific. It's a general peds program where you've integrated primary care, palliative care principles.
Right. But as I mentioned before, if we do have pediatric students that are interested in learning more, we have all of those other opportunities for them. So certainly there's primary palliative care, just like any other student would get. But if you are pediatric in our P&P and you come to me at the beginning of your program and said, I really want to focus on palliative care, we will make that happen. And we will make that happen by integrating all these other components into your coursework. So we would add in the specialty palliative care courses. We would add in specialty clinical hours with our team. We would sign you up for the externship. We would, encourage you to do a DMP project in palliative care and really have, alongside your track for getting your PMP would be this palliative care experience. And I think that's what's really helped elevate some of our students' desires and, granted them access to leaving our program feeling like they have this, they might have, their education and their certification in family or pediatric, but also a focus in palliative care, which has really made a good difference for them.
And your LNEC graduate curriculum, all those modules are woven in to one particular course, right?
The Relias LNEC graduate curriculum is over one semester. We have learned, just like many schools have, and some of you on this call probably have, we've tried it a few different ways. We used to have it in our residency program for several years. And then I realized that students that were leaving at the master's level weren't getting it. So here I was boasting that, yeah, we give it to all of our graduate students. And I was missing not a large group, but enough students that I was like, oh my gosh, we need to back this up. So we decided to just keep it over one semester, and it actually is working pretty well. I think it makes sense for it to be in their role course. They've had kind of the basic clinical courses, so they have a pretty good understanding of disease process, and then can dive into some meaningful conversations about palliative care when they get to the role course. So it seems to be working, and we capture all of our graduate students that way.
Mm-hmm. Mm-hmm. Some of you mentioned things that you're doing in your program. I think Dr. Noon mentioned early on they're starting a master's program in nursing education and just beginning to do this work. And Caroline Wilson, we integrate palliative care as a module embedded in primary care courses in the MSN FNP program. So would anybody like to share the kind of things that you're doing, or pose more questions about getting started with our experts here? Just open up the mic.
Hi, this is Joanne. It's not a new program, but it's an
Oh, okay.
existing Master's in Nursing Education, and went to your presentation at the NLN Summit. And so that started me really thinking about that part of the essentials. So we're just starting to do our essentials work. We are looking at the LNEC curriculum and where that would fit in different courses right now. So I do have some faculty looking at that. I do actually have a faculty with expertise in palliative care. We're also looking at, and they're also looking at serious illness conversation certification as another potential opportunity. So we haven't landed on anything yet, but just those are the things we're looking at right now.
Thank you.
Hey, Andra, this is Nancy Stock. I logged in late,
Nancy.
but I wanted to just share a little bit about what I've been doing in Moorhead, because I've been teaching the LNIC course in end-of-life nursing care for undergraduate. I'm expanding it to graduate, and I'm integrating social work with it, with the SBEC curriculum.
Nice.
So it's going through curriculum, our university curriculum committee now, but I'll be teaching that in the next year.
Where are you?
Yeah, where are you?
By Fargo, North Dakota. It's Moorhead, Minnesota. Minnesota State University, Moorhead.
Nice.
I'm so jealous. I like wish we could have a social work component, and we don't have that that track here at our university, but I'm determined to figure out a way to collaborate with our College of Charleston school that's nearby. But that's wonderful, and I think your discussions and your collaboration will be wonderful, having that that kind of specialty involved. That's great.
We're integrating with Masters of Health Administration, and the EDD will be one of the electives that they can choose for those tracks as well. So we're excited to get that going.
Good to see you, Nancy.
Nice to see you too.
It's been a few years.
Yeah.
I want to just read, Marcia put in the chat, Marcia and one other faculty member teach the palliative care for nursing course in their non-nursing BA, BS degree to MSN graduate program. And we use the graduate LNEC course via Relias with our students plus additional material. Classes are 50 to 75 students. That's big. And the students find this course to be very helpful. We have changed the course to term 3 from term 6. So kind of maybe differently than you just described, Carrie. This allows our students time to practice what they have learned. So they're upstreaming it a little bit. And Marcia is jealous at the number of faculty that you have at your university.
Come on, join us, Marcia. Well, that's wonderful. And I do think there's something to be said, certainly, about offering it earlier. And it's still earlier for some of our DNP students, but I think, I've heard so many different ways to do this, and you really have to look at what works best for you and faculty workload and student time, and you don't want them overburdened with the work. I did hear from one student a few years ago that she just clicked through the slides as quick as she could because she didn't have time. And I said, okay, pause. We need to relook at how we're offering this and make sure that it's something that we're doing that we truly have time for, and students have time to let it sink in. So, but nice work.
Thank you so much. This is Marcia. I turned my camera on. And
Great. Thank you, Marcia.
yes,
Thanks
just
for
an
sharing.
FYI, I'm winding down to retire. And so we really would like some help. Anybody want to come to Chicago and start up a bigger program? Come on, guys. It'd be great.
Chicago's a wonderful place, and congratulations to you.
Yeah, thank you.
I know someone at Loyola who might be movable.
Okay. If you
Do you
just
have,
want to.
do you have your contact information? You want to put your contact information?
Yeah,
in
if you put it
the
in,
chat?
she just, she just finished her DMP last December and her area of focus is palliative care.
Fantastic. Is she adult or peds? Do you know, or family?
Adult.
Adult. Okay.
Wow, that's
Put your email in, I can connect you.
Okay, thank you. I'll put it in the chat.
As we get ready to wind down, first of all, I want to say thank you both so much. This has been really wonderful, and your program is amazing. And I knew some of it, but wow, I didn't know all of that. I'm impressed. I was already impressed. I want to just let folks know that if you are interested in growing your palliative care educational sort of competency yourself, I guess, we are going to be having a workshop for faculty in palliative care teaching and integrating it into the curriculum next summer here at Portland, University of Portland, where I am. We had hosted one last summer, just a few months ago, last summer. And we hosted 111 faculty from around the country, 38 states were represented. It was really incredible. And we are funding it largely. So applications will open up in early spring, in the first part of the year. If you're interested in that, the dates, just if you want to pencil it in, are July 23rd, 24th and 25th. July 23rd, we'll put you in housing. So it'll be funded except getting yourself here. So applications, because you're on this webinar, you'll be added to the distribution list when that announcement comes out. So you'll hear more about it.
And with that workshop,
not you, maybe one of your colleagues.
Last year was just for undergrad. This year, we're excited to say we have a dedicated track for graduate faculty at our summer workshop. So that's
yes, thank
what
you.
We're hoping you as graduate faculty will come join us. Whether you're an expert or not, doesn't matter. We just want you to come and join us for that. So keep on the lookout for that application.
Dr. Lindell mentioned the Faculty Corner. I just put the link to the Faculty Corner in the chat. It is a repository of resources for faculty teaching, and evaluation tools, a list of all the upcoming webinars. I think the link here is specifically for the webinar series. The next one is November 12th, Advancing Palliative Care Education Innovative Strategies. We have, I think, 3 different schools represented, and they're going to share the really innovative things that they're doing in teaching. And Ryan just posted, if you're interested in looking at and accessing the curriculum itself, just send an email to elnick@cityofhope.org, and you can get as many tokens, if you will, to have access to the curriculum. Any questions?
Thanks, everyone. Thanks for the opportunity.
Wonderful. Thank you all so much.
Thanks for joining.